Hello there, my name is Matthew Shaw. I'm one of the spinal surgeons at the Royal National Orthopaedic Hospital. This video has been set up to talk to you about the Enhanced Recovery Programme at the Royal National Orthopaedic Hospital in relation to your surgery, which will be a posterior fixation of your scoliosis. So I'm going to talk to you today in this video concerning the actual operation, and I'm going to talk to you about the recovery following the operation. So you have a curvature of your spine which occurs most commonly in girls and often it's seen about 1 in 200 of the population. This curvature is of a size which we think will progress in later life, which could cause pain or deformity of your spine. And obviously you've realised that there's some things about your body which aren't quite symmetrical. So you might notice that one side of your chest is slightly more prominent, one side of your back is more prominent, or you've got one hip is more prominent than the other. So the operation entails you coming into hospital and having an operation which involves screws and rods being placed into your spine in order that we can correct this deformity and straighten your spine in order that it doesn't continue to progress throughout the rest of your life. This operation generally takes between 2 to 3 hours, although with complex curvatures it can take slightly longer or occasionally shorter than this period of time. You will actually be away from your ward bed for approximately 4 to 5 hours because it takes the anaesthetist around about 30 minutes to put you to sleep, and you'll wake up after an hour following the operation. So therefore it's likely to take 4 to 5 hours before you're back in a bed, and that would normally be in the high dependency unit following your operation. You would normally spend one night there before going back to the ward, which is the bed you would be admitted on in the hospital. The operation itself, as I've said, involves putting screws and rods into your spine. And with anything we do, there's always risks, and it's important you understand those risks. When placing the screws, we can injure the nerves or the spinal cord, which can lead to weakness of legs or arms, or occasionally both. This is a small risk happening about 1 in 300 to 1 in 1,000 occasions. Normally the effect is a temporary effect where weakness is short-lived, and then the nerves recover and full function is returned. But this is certainly something that we worry about, and understandably you'll worry about it too. We do everything we can to try and stop this from happening in terms of monitoring the nerves in the operation. This involves placing sticky pads when you're asleep in the anaesthetic on your head, your arms and your legs in order that we monitor the nerves while we actually perform the operation. Most times the nerves stop working not because we've placed screws in the wrong position, but because when we straighten the spine, your spinal cord doesn't like it and then can swell and then stop working. And as I've said, this normally returns to function over a number of days or occasionally months following the procedure. With any operation that we perform, there can be a risk of infection, and in this type of surgery the risk is approximately 1 to 2%. This could mean simply giving you antibiotics, or it could mean the wound needs, the actual scar itself needs to be washed out, and then you need an extended course of antibiotics, which sometimes can be 6 to 12 weeks. Rarely the infection can be so serious that we have to remove the metalwork. Following your operation, and what this program, what it's all about, is to get you up and out of bed and out of hospital as quickly as possible in order to avoid the other potential complications occurring with this surgery. And these are things like clots in your legs, what we call thrombosis, embolisms, which are clots in the lungs, chest infections, or urinary tract infections, so infection of the urine. The quicker we can get you out of hospital, up and about, with all the lines and things that we need to perform the surgery out, the lesser the complications will be, and that's the idea of the Enhanced Recovery Programme, in order to drive you to the point where we can get you home earlier than has traditionally been expected. I would hopefully see that you will be out of hospital in 5 days following this procedure, and I would expect immediately after the operation to try and sit you up, and over the coming days to then sit, stand, walk and do stairs, and by day 5 you will be competent at doing stairs, being able to look after yourself, having opened your bowels, be eating normally, and then at that point, once you've had an x-ray, we'll be able to get you home. The overall recovery from this surgery takes a number of weeks or months before you'll feel your normal self again, and will restrict your activities in terms of sporting activities for a number of months following the operation. Potentially you could ride a bike after 6 weeks, you could swim after 3 months, but contact sports would be further delayed to around about 9 to 12 months following the surgery itself, in order that after we put the screws and rods in, that the bones fuse together in their straightened position and the metalwork won't fail over this time. So I hope this has given you some insight into the Enhanced Recovery Programme at the Royal National Orthopaedic Hospital. You're going to hear from a lot of other professionals that are going to help look after you during your stay here, in terms of your physiotherapy, in terms of moving around, in terms of the dietitians and giving you appropriate nutrition to make you well after your operation. And I hope that you'll have a great stay with us and you'll be out in 5 days following your surgery. Thanks again.
Hi there, my name is Penina. I'm one of the ward sisters here on Coxon, the adolescent unit. We provide 24-hour care for you while you have your hospital stay and your operations. All the nurses on the ward work 12-hour shifts from 7:30 in the morning till 8 o'clock at night, and each shift, day shift and night shift, you'll be allocated a nurse who is there to look after you. So nurses do absolutely everything. When you've had an operation, we're looking after your observation needs, so we'll check your breathing and your oxygen levels and your heart rate and your blood pressure and all those sorts of things. We'll make sure that your pain is under control. If you need any sorts of painkillers, we can regulate how often you have your painkillers. It doesn't all have to be tablets if you can't manage those. It can be liquid tablets. Some of your medicine goes in a drip in your arm. We try very hard to make sure you're always comfortable and that your pain is under control. We also look at your wounds, anything like that. Most of the time we don't have any wound problems, but that's what we're here for. And your skin, you're not allowed to stay in one position for a long time, so we'll teach you how to turn safely and make sure that you're always in a comfortable position. Make sure you're eating and drinking, that you're having enough fluids. You may have a catheter after your surgery, and we'll make sure that all of that is in place. We also help with your personal hygiene needs. If you're on bed rest for a little while, you'd be surprised what we can do while you're still in bed. We can give you a full wash, we can wash your hair, we can help brush your teeth, we can even change the sheets while you're lying in bed. We do something called family-centred care. That means your mum and dad are welcome to be here all the time or none of the time. They can be as involved as you like. So if you'd like your mum to help you have a wash or help you turn or do things to help you, that's fine. If not, then you don't have to at all. The nurses will help. We have open visiting hours for parents. We do have parents' accommodation, but if your mum or dad wants to stay with you, they're very welcome to stay on the ward. Can't guarantee them a bed, but they're very welcome to stay with you. And brothers and sisters and other visitors are obviously welcome if there's not too many people, it's not too noisy and it's not too late at night. Right, what else do we do? We try and make it a nice experience for you. We listen to your problems and we give you as much help and support as you need. We work very closely with surgeons and with the paediatricians who are on the ward every day to deal with your medical and surgical needs, and then obviously with the play team, with the dietitian, the physio, the occupational therapist. So the nurses are always on the ward, always there for you, and will liaise with all the different professionals who are involved in your care. It's usually up to the nurses to decide when you're ready to go home. So we decide when you come down off your strong painkillers onto the next thing. We decide when we take down your fluids, when we decide when to take all the tubes and lines out of your arms. So it's worth knowing the nurses.
Hello, my name is Sheila and I'm a physiotherapist. A physiotherapist will see you before your surgery. They will want to make sure that you have no problems with moving around, and they also would like to check your breathing by using a lung function machine. This is a machine that you blow into and will measure how good your breathing is. The day after your surgery, a physiotherapist will see you to teach you some exercises for your breathing, for your circulation and for your strength. We will also hope to be able to help you to sit over the side of the bed, and if you feel well enough, to try standing. For the next few days, we will help you to improve your confidence in getting in and out of bed, sitting in a chair, walking around and going up and down stairs. We'll also make sure that you know what to do and what not to do following your surgery. This includes your PE and sports activities. We would expect you to be ready to go home by day 5 following your surgery. You should not need any further physiotherapy, and we expect you to return to your normal activities as you can.
Hello, my name's Edwina and I'm the occupational therapist. Before you come in for your surgery, the occupational therapy department will send you a short questionnaire which will ask you about how you currently manage your day-to-day activities, such as getting dressed, getting washed and getting to and from school. The questionnaire will also ask you about the height of your chair, the height of your bed and the height of your toilet. And that's because after this surgery, it's going to be a bit uncomfortable for you to sit on things that are too low. So once you send the questionnaire back, we'll have a look at that and make sure that everything in your home is of the right height for you. Once you're on the ward and you've had your surgery, we'll probably catch up with you on day 2, by which time you would have seen the physiotherapist who would have got you up. We will then make sure by day 5 that you can get in and out of bed, you can get in and out of your chair and on and off the toilet and in and out of the bathroom or shower in preparation for going home. We'll also talk to you about lower body dressing and getting in and out of a car. Lastly, we will talk to you about returning to school or college, and we will send a letter to your school or college, and we recommend that you go back to school or college 4 to 6 weeks after surgery and get back to your normal routines as soon as you can.
Hi, I'm Trudy and I'm one of the dietitians at the Royal National Orthopaedic Hospital. I'm going to talk to you about your diet before and after your surgery and what we expect from you in order to get you home nice and quickly after your back surgery. There have been some new advances in the area of nutrition in regards to having surgery, and by following all of the advice in this video, we hope to reduce your time in hospital from 11 days down to only 5 days. Your body should be in the best shape possible before you have surgery. This will help you recover quicker, heal your wounds, and help prevent any complications to ensure you leave hospital on time. So it's very important that you're well nourished, and here is some very useful info for you to follow. So it's important to eat well leading up to your surgery to give you enough energy to cope with the operation. You'll be asked to drink 2 sachets of an energy drink called Preload the night before your surgery. This is an example of what one of these sachets looks like. This will help to top up your energy levels even more. On the morning of your surgery, about 2 hours before your operation, you'll be asked to drink 1 more sachet of this Preload. You should mix this up with 400 ml of water, so approximately this size, and you should add no other flavours or fluids to this. Then you should try and drink this drink within about 5 to 10 minutes of it being served to you. So after your surgery, whilst you may not feel like eating and drinking after your operation, this is the time that your body burns the most energy, and therefore it's very important that you attempt to eat and drink. You might feel sick, but the doctors will give you the medication to help with this. So you should start eating as soon as possible after your surgery. You should try choosing high protein and high energy foods from the menu, and you can always ask the nurses to help you pick out these particular foods. And if you can't eat a meal, a milkshake will be offered to you. So sipping on these is an easy way to get the energy back into your body to start the healing process. These drinks come in all sorts of flavours, so you can ask the nurse which one you would prefer. Snacking on high energy, high protein snacks every 2 to 3 hours may actually be easier for you than eating full meals after your surgery. A common issue after your surgery is that you become constipated, because of the anaesthetic and the pain medication mainly. So to prevent this from happening, you'll be given a laxative medications from the very first day after your surgery. You must take these to get your bowels and digestive system moving. These will also help with your appetite. We know that laxative medications aren't always the nicest to take, but by taking them regularly will mean your bowels and system start working and you'll get home much quicker. Other things that can help your digestive system to work is you could drink plenty of fluids in between your meals. You could also try chewing on sugar-free gum, so 3 pieces per day, up to 30 minutes at a time. Also, you could take a cup of prune juice, and this can often be mixed with apple juice to make it taste a bit better. Also, taking some warm fluids, for example, tea, coffee or water, early in the morning before you have your breakfast. Stomach massage is also really useful, so you can try massaging your stomach in a clockwise direction. This can be comforting and helpful. Also, changing your position, so from sitting up to standing up, and also do this with a physiotherapist. This will really help get your bowels moving. So the key things to remember after surgery: you should be having the high energy, high protein snacks every 2 to 3 hours. You should sip on a milky drink between meals. And if you do feel sick, it's really important you take the anti-sickness medications regularly. And finally, just to recap again, to help your bowels and digestion start working. You must take laxatives that have been given to you every day. You should drink plenty of fluids, and you can also try having the sugar-free chewing gum up to 3 times a day. Also, as we mentioned, a glass of prune juice or a warm cup of fluids can help. If you are still having problems, you can always ask to see one of the dietitians on the ward.
Hi there again. So you've now heard about the Stanmore Enhanced Recovery Programme for scoliosis, and you've heard from myself, the physiotherapist, the dietitian, the nursing staff and the occupational therapist about your stay here at the Royal National Orthopaedic Hospital. And we hope you can have a great stay with us and get up and about and be home in 5 days. Thanks very much.